Welcome back, everybody. So fall, we officially welcomed it yesterday, and with kids back at school, that means it's also the start of a steady stream of colds, flu, and dreaded lice.
I know, but fear not, because Dr. Sheila Wijayasinghe is here to break down the most common ailments, how to prevent them, and what to do when they strike. So welcome back to the show, Dr. Sheila.
Okay, is it just anecdotal, or is it true that it feels like kids and all of us start to get more sick once kids are back in school?
Oh, 100%. We're in it right now. 'Tis the season, right? When kids go back to school, they're in close quarters. For first-time kids, they get on average like 8 to 10 infections in the first year of going to school. Wow. Always important to know that. And it's really disruptive. Like generally they tend to self-resolve, they're mild, but they can be kind of gross. Kids are germ magnets.
Yes.
And so they just touch everything, they put everything in their mouth, and as a result, they get sick and then they bring it home to us, and then we're also effective.
Yes, of course.
Yeah.
Well, let's start by talking about the thing that many parents live in fear of, which is lice. Oh, there's a picture of it. Sorry about that. How do kids get it, and what's the best way to treat it?
Yeah, I feel like we all get itchy when we talk about lice, right? It's really common. So it's super common. Lice is not dangerous, but it's irritating. It can cause itchy scalp, and it's just kind of gross. And so super common, and why we need to do this is we treat it. So if your kids have lice on their hair, it's actually transmitted from head-to-head contact. So direct contact, it doesn't jump from head to head, which is a common misconception. So if they're sharing hats, if they're sharing brushes, if their hair is right next to each other, they can also transmit it. So that's why it's so common. And we see these outbreaks happen in schools, and then we have to treat it. And we can treat it with over-the-counter options. And then generally the main thing I want to share about lice is that after kids are treated, they can go back to school like the next day, or even within after hours of being treated, because we don't want to keep kids out of school for something that, again, is very common. You want to be proactive about lice. You want to make sure you're brushing your kids' hair regularly, looking for lice. Our school is actually doing lice checks once a month now because it is so common, and it's highly stigmatized. It's not about
big time.
It's not about hygiene. It's not about if you're not washing your hair. It's actually just super common that we can get on top of with proactive care.
Great.
Oh yeah, that's good to hear. Okay, let's talk about hand, foot, and mouth disease.
Yeah.
I find especially when our kids, little ones, when they were in daycares especially, or younger grades.
Yeah.
So what should parents watch out for? How do you manage it? Because it can get gnarly.
It can be very, very painful. And so hand, foot, and mouth disease is a viral illness. It's self-limited, so there's not an antibiotic that we can give kids. And just like it's described, it's blisters that can happen in the hands, the feet, and in the oral cavity. Oh. And so it doesn't always happen everywhere, but especially when it hits the mouth, it can be so uncomfortable that kids actually stop eating and drinking. Oh. And that can cause dehydration, and that's where we really manage with pain management, like acetaminophen or ibuprofen, and that's all we can really do, and make sure that they're hydrating well. It can last about 7 to 10 days, and generally once the blisters dry over, it's considered to be safe to go back to school. But it can last in stool for about 4 weeks, which is why we see it cycling in daycares, and why hand washing is so important. Okay. Adults can get hand, foot, and mouth as well, and they can be quite severe in adults and cause a lot of pain and distress. So we always want to wash our hands and be aware of that risk as well.
So is it contagious?
It is contagious. It is highly contagious, which
okay.
is why we see it rapidly spread in daycare settings.
Okay, well, we know that nothing spreads faster than a horrible stomach bug. So what should parents be aware of and do when vomiting and diarrhea and things like that hit the house?
Yeah, very common. It's kind of like the gift that keeps giving, right? Kids come home and they just they're vomiting, then you start vomiting. It's awful. And so nausea, vomiting, abdominal discomfort. And really, again, it's viral. And so there's no antibiotic that we use to treat it. And it's symptomatic treatment. So we're using the pain management, fever management as well. And again, you can lose a lot of fluid, so you want to make sure that you're hydrating well through that time.
Okay, is there at a certain point, it sounds like we just have to manage at home, but is there a certain point where we should worry about any kind of gastrointestinal bug?
Yeah, so dehydration can happen with gastrobugs, and the Canadian Pediatric Society recommends rehydration fluids to help get through. But if that's not enough, and we see kids in our office who aren't producing tears anymore, their mouth is dry, they're not peeing anymore, they've gone hours without peeing, those are signs of dehydration that should get checked out if they're not responding to oral rehydration that you can buy over the counter. If they have blood in the stool or a high fever or very significant pain, also a really good reason to see us.
So we're also heading into cold and flu season. So this is always something I feel like I don't really know the difference between a cold and a flu, and I feel like people use these words interchangeably. So how do we know when something's more serious?
Yeah, so colds are really common. They last a few days. They're more mild in nature, so generally runny nose, congestion, maybe a low-grade fever. A flu is much more significant. So if you've ever had it, can take you out for a couple of weeks. You can get a high fever, chills, and fatigue, and there's significant flu-related complications that can happen especially in younger individuals and older individuals over 65. And this is why prevention is such an important piece. We learned a lot from the pandemic in terms of how to prevent these things. First off, the vaccines are coming out in the fall. So if you're over 6 months, you can get the flu vaccine, you can get the COVID vaccine. COVID is still around. We always want to hand wash and also use masks or stay out of public spaces if you are sick or coughing. Those are ways to decrease transmission. And there was a really interesting study in Europe that actually looked at kids when they got colds and flus, and they did nasal saline rinses. And what they found when parents started those saline rinses at the first onset of a cold, it decreased the duration of their symptoms by a couple of days. Oh, wow. And it also decreased transmission to other people in the family. So if you want something that's low barrier to do and low cost, try the nasal saline rinses.
Okay. Yeah, I remember when you posted about that, and I just bought all the nose kits.
Yeah.
Just squirting my brains out. Okay, we want to stock up our medicine cabinet before the season really hits. What should parents have in there?
So absolutely, this is like your toolkit, right? And I think the start of school is a great time to do it once a year to make sure your medications aren't expired and that you're up to date, because you don't want to reach into that cabinet in the middle of the night and not have something that works. First off, I think having a digital thermometer is really important to know if your child actually has a fever. Often parents come in, they're like, they're warm. It's helpful to us to know, do they actually have a fever or not? You want the pain and fever precautions as well. So acetaminophen and ibuprofen. We know that Tylenol is safe. We've talked about this today.
Sorry, what was that, Dr.
Tylenol is safe.
Tylenol is safe.
And it does, right? And especially for adults, you want Tylenol or ibuprofen, and for adults too, because we also get affected, right? We also want things like antihistamine. So, like for allergies that may happen, diphenhydramine, which is Benadryl, has fallen out of favor. You want to use other ones, like the other common ones that you can get over the counter. Our family has gone through lice, and so I have a lice kit at home. You can always get that over the counter anytime you want. The saline spray, like you said, Mel, is important. Bandages, popsicles are like electrolyte fluids to have at home. I have them in the freezer for the kids in case gastro hits. And then having a humidifier is really helpful. And then in the middle of the night, I tell my patients, if you are needing fever precautions at night, make sure that you have like the dose written down somewhere at night so that you're not reaching for the bottle and looking at that Chinese print.
You cannot see it. I take a picture, I have to zoom in. That's a really
So have
good
it ready on the night before, just in case you need it. If you don't need it, you can always use it later.
But quick one, I got to sneak in here. Cough syrup.
Yeah, cough syrup under age 6 is not recommended for kids, so avoid cough syrup. Instead, you can use honey and water for kids over the age of 1, much more effective.
Okay.
Done. Dr. Sheila, bring in the knowledge today. Thank you. Okay. I hope you PVR'd, screen grab what you need to have to be ready for cold and flu season and all the fun stuff ahead. Let's take a break. We'll be back after this.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.